Well, this comes as we're just learning the federal government also pulled nearly $2 million of COVID immunization funds from the Minneapolis Health Department. Jennifer Hoff talked with workers about the services that had to stop immediately. Jennifer?
Julie, the announcement came 2 weeks ago to the day, and since then, nearly 90 vaccination clinics are now shut down. That not only gave COVID-19 shots, but other vaccines at a time when immunization rates are down across the city, in some cases by double digits.
Grab your food, grab your seat. We are going to get started.
There weren't any capes in this crowd.
You all should get recognized more.
There were certainly still heroes whose work for Minneapolis Public Health was recognized at an award ceremony. At the same time, federal support for the agency was just eliminated by as much as $1.8 million.
It was a shock.
A shocking decision for leaders in charge of free vaccination clinics in underserved communities, forced to close all 87 of them immediately.
We're reeling a little bit, and we are trying to now go back and figure out how to still do some planning and how can we maintain.
The clinics provided more than 2,000 shots last year, in part for COVID-19 and the flu, as well as immunization series for Mpox and measles, when officials say only 70% of the city's 6-year-olds are up to date, 25% less than the target goal, and as outbreaks continue across the country.
To know that there are children out there that could potentially not have resources to be protected from certain things is very emotional and very devastating.
The Trump administration defends the decision, saying the pandemic is over and will instead prioritize funding projects to address other chronic diseases.
I take issue with saying COVID is over and therefore this money is not needed anymore because, one, COVID isn't over, and two, there were a lot of fallouts from COVID that we still need to be addressing.
So to be clear, all of this funding would have expired by next March anyways, but this is such an abrupt decision. It's leaving all of these people in limbo, especially when they weren't even notified that this work was anything but satisfactory. And now Democratic attorneys generals in 23 states have filed a lawsuit against the U.S. Department of Health and Human Services as all of this sort of plays out still, Julie.
So they knew the federal funding was going to end in March. Were they hoping to re-up it? Was there some thought that this would keep going despite that?
I think they would not want to see any of these clinics go away, right? So there was going to be planning in the future to keep these up and running, but where that money would have come from, I don't think they know that yet, but of course this just puts a bigger wrench in where that's going to come from now in the future.
All right. Thank you, Jennifer.